Okay, now what do you do? Can you even put an implant in there? Well, not exactly, no. So there's always different things that come along, so there's a need for, more and more treatment that can become more expensive, obviously, than routine. It's not just a filling or one crown every few months or something, or a few months, years, hopefully, but it depends. So you don't know what the future is, depending on how healthy. Health is your wealth? Yes, it is. Yes, it is. Is PPO right now, I would say.
Okay.
And the reason, basically, dental insurance isn't really insurance.
I feel like it's more like almost like a discount.
That's what
plan.
It is. It's a discount.
And I have to stop myself, but I almost, when things are wrong, I'm fine. But I almost like to do the math. Like, I'm paying for this insurance. What am I really paying for? And, I'm always going through the bills and going through, what is my insurance company paying and what am I paying? And if I stop paying for my dental insurance, could I just, fund this myself? So I struggle with that a lot. But the thing that keeps me paying for dental insurance is as I get older, I know that I'm going to have more problems, and it's better to have a little bit of something than, just coming out of pocket. What do you think?
I don't. I think about that because there's a cap on everything you do. In other words, okay, this is you got this year, depending on what you're going to pay.
$1,500 is the cap.
Well, and make no pun intended, that's one cap.
Yeah, that is, yeah.
We
if you have
call
a
that a crown.
root canal?
Yeah,
root canal is when you get the cap on?
Yeah,
okay.
You should. Yeah,
so
you should.
If you get a root canal and you get the cap, you hit your...
You're already over it.
You're over your limit. And if you need nowadays for orthodontics, right? If your kids need braces, you're limited to, I think, a lifetime of $1,500.
Yeah, which is about a third of what usually it's around 4,000 or 5,000, depending on the complexity of your child's case. So a lot of these things, all they are, and say you have need. Okay, you broke something. Say what we do all the time. You got a partial, a tooth broke off. Had a patient this morning. Exactly what happened. Okay, now say this person is a fee-for-service, full pay. She does it herself because she's smart enough not to have dental insurance. And okay, so you need now say that partial was made 2 years ago, but a tooth supporting it physically failed, and it's now no longer restorable. The insurance company says, well, you can't get another partial for 3 more years because we have a 5-year rule. Some of them have a 10-year rule. That's the worst. The best is about 5, and sometimes somewhere in between. Okay, so now wait a minute. You lost a key tooth. This lady lost a cuspid, broke it off. You can't fix it. You can't do a root canal. I mean, oh my God, you'd still be worthless when you got done with it. You could spend $2,000 on it for nothing.
Right.
And so, okay, now what are you going to do? Well, the insurance company said, well, we'll do a repair on that partial for you. That's worth $200. But they're not going to make you another one, or they're not going to pay for a denture, for example, because it's on the upper arch and you had a partial.
So do you think, and it seems like with a lot of insurances, and again, I know he says that, forget about dental insurance, but when it comes to insurances, shouldn't people, if somebody is in their 60s and they're reading these plans, they're confusing. They're confusing to me. I'm a certified financial planner. It was part of our CFP exam to learn, we had to answer all these questions and learn everything about Medicare and Medicaid, and it was confusing to me, and I kept thinking, well, how's my grandmother going to understand this if I am racking my brain? So do you think that when people are going through their insurance policies and trying to determine what they have, that it's advantageous for them to either talk to their dentist about the plan and find out what the coverages are and what they mean, or have maybe one of their adult children involved in the picture? What do you
Absolutely, because they're meant to be confusing. I mean, I right off the bat, I will say I am not an advocate of insurance. I think in so many ways, whether it's your auto insurance or workman's comp, if you're a business owner or whatever it is, all I do, I just feel it's just a license to essentially steal money.
So
I mean, that's how I feel about it, because they want to hold about 40% back and then not distribute the 60%. So in order to do that, and that's why they're so profitable. And my opinion is, I read some of these things, and my partner and I, we don't accept insurance. We don't take it. We're specialists. We're out of network all the time anyway. So, we would be foolish if we did, because we'd limit our fees and we'd go broke.
Right.
Because it's a way of selling you, like, okay, one example I'd give. Okay, you lose 10 cents on every dollar for these patients that we're going to give you because you're in this network. How many patients do you have to see to make a profit?
Right.
Excuse me? You're still 10% down. You can't make a profit discounting yourself down to nothing. But it's a semantics world, and I think the patients are caught up in this. I read some of these things and I go, what did I just read here? I don't know, much less your 80-year-old example. How in the world? No, it's confusing.
It's confusing.
And okay, so you have this catastrophe. My patient this morning, okay, she breaks a tooth off. She's got a fairly new partial. If she had insurance, which she doesn't, then they'd say, well, that arch has been covered, and they will probably decline it.
Because she'll have to wait X number of years.
Yeah, she needs a denture now because she lost such a key tooth. She's only got 3 other teeth. She's really, and the other one's going to break on the other side. We don't have anything left. So we need a denture. Well, gee, sorry. I mean, it probably won't cover it. And then they even make matters worse. Okay, she gets a denture. We don't do the 2 dentures anymore, like a temporary denture, because insurance companies tell us that we can't do that. That's bundling.
Why would you do 2? Why would you do
well,
the temporary?
one is just to kind of give you one to get going, and then we can, when you have some teeth present, and some people's teeth are not in very good shape, you can't try them in and take a look at what you're going to look like. We have to kind of, I'll call it extrapolate, not guess, of what it's going to be. It's certainly going to look better when they walked in the door, but there's certain things that after you shrink from normal surgery and all that stuff, we can do better. So in the past, I love to make like one denture and then within a year make another one. And we used to kind of put them together, but most insurance companies today say, no, you can't do that. You either get one or the other. So, even if it would be the best treatment, depending on how much periodontal disease you have, how much you're going to shrink, there's all kinds of factors in there that would say, yeah, that making 2 dentures, but when you're limited by an insurance company to 1 in 5 years, now what we do is we just make a really good high quality denture and hope that
and hope for the best.
and hope that we can modify it to make it suitable.